All right, Jeff, thank you very much. As our communities slowly begin to reopen, our places of worship are considering how to begin in-person services safely.
Absolutely. That challenge also true for faith leaders in the African American community who in Kansas City suffer from a higher coronavirus rate. So we are proud to be joined by Dr. Janette Berkley-Patton from the UMKC School of Medicine with us this midday to talk about the work that she's doing to help this faith community reopen safely. Doctor, thank you so much for joining us this morning.
Thank you for having me.
So, Doctor, how are you helping these faith leaders, and what do they need as they get ready to welcome back their congregations?
Well, I can say that our faith leaders are very concerned about the health of our community, especially our African American community in Kansas City, and that they are not rushing back to open the doors of their church without having the precautions in place. And so we've been working with pastors along with Calvary Community Outreach Network and many of our other faith-based organizations to help them understand and help them to develop some methods to practically apply the reopening guidelines that have been put forth. And how do those guidelines get applied in the faith-based setting?
Doctor, so much of the faith community has been a very contentious part of this, whether it be businesses reopening, schools being shut down, what's going to be allowed to come back and when. It seems like on both sides of the state line, the faith community has been one of the more contentious spots because people want to be able to get back to their churches. Churches want to be able to get back open. We've seen some churches file lawsuits to be able to open. Why is it this point that's such a point of contention when it comes to people being able to get back to their churches in the midst of this pandemic?
Well, I can only speak to the faith leaders that we've been working with. And again, they have not been in a rush in the African American community to get back to regular church services. They have been diligently conducting virtual services. Some have been created and have done drive-in services. And of course, are using social media as much as possible to put forth their messages of faith. And so they want to ensure that when they do reopen, that they have all of the guidelines in place to make sure that their members are safe in church and also at home. And so we've been working with them to figure out, okay, how can these guidelines be applied in the church setting in a way that allows people to know that they're safe, that they can be comfortable, and that they can worship freely as well.
Doctor, is there any message that they bring to you from their congregation that they need your help from a medical perspective, any myths to dispel or anything like that?
Certainly what our faith leaders are saying is that they really need support with PPE and providing people with the protections that are needed so that they can be able to pass out masks, so that they can ensure that they have and can provide to their members hand sanitizers and other cleaners and disinfectants, and that they also have testing available. You may know that many of the pop-up testing sites that have been occurring in Kansas City are happening at churches, in our African American churches in the urban area. And so they want to see more of those testing events being available to their members and use their pulpit as a platform to promote COVID-19 testing with not only their members, but with the community members that they serve.
Clearly a really important place to spread that message so far. We're seeing that a lot so far on both sides of the state line. That's Dr. Janette Berkley-Patton from UMKC. Doctor, thank you so much for your time this morning. We appreciate it.
Thank you for having me.